Okay, hello. Good evening, good morning, good afternoon, depending on where you're watching me from. Welcome again to the Pungent Talk Hub, a place where we have real conversation and then silent truths. Today, I want us to discuss an issue that is befalling each and every individual out there. It's an issue that revolves around our healthcare and our health in general. Before we dive into it, if you haven't subscribed, kindly hit the subscribe button, knock on the like button, strike on the bell, such that when we release any new release, you are able to find it out or to get it in time. Now, let's dive into it. Now, there is a story. This is a story that has been in our media for quite some time. It was aired in one of the media stations within our country, uh, whereby there's a lady who went to seek medical attention in one of the prominent hospitals in Kenya, which is KNH, and she was in labor. She went for delivery. Unfortunately, she was induced and placed on some medication, and that is the point when her problem started. Now, before I get into it, I want to share a little bit of the clip so that we can be able to dive into our today's conversation.
Nimeishia kwa mwili wangu hizo madawa
Now,
nimekuwa nikimeza all these years, nisikosa dawa hata siku moja. Mi naitwa Evelyn Sobet 23. Nilienda Kenyatta kubook kujifungua mtoto, lakini ikawa niliwekewa kwa kitanda na nikawekewa dawa, nikakuwa induced na shida yote ilianzia hapo. Mtoto alifurutwa na vacuum, ilikuwa shida ya mgongo. Baada ya hiyo tena wakanidunga shindano kukausha maziwa,
listen very
na
carefully.
mtoto si ati alikuwa ameaga, nilikuwa bado niko na mtoto. So wakati mtoto alifurutwa na hiyo vacuum plus na hiyo shida pia aliwekewa, kuja kuangalia mtoto akawa ako na shida ya Down syndrome. Nilianza like day one sasa kufuatilia mambo ya mtoto ya occupational therapy for the last 7 years akiwa mdogo, mpaka wakati walisema speech, lakini sasa hana speech lakini anaelewa. So na manage mtoto mpaka leo hii bila dawa ya kumanage ataconvulse. Mimi nimegonjeka sasa 22 years, magonjwa imekuja ikafuata ikawa nyingi. Sasa shida ya mgongo ikaendelea kuworsen mpaka nikapelekwa India, nikawekewa metals na plates. Nimerudi Kenya, nimekaa tena, shida ikaendelea tena ya sciatic nerve. Niko na arthritis, niko na ulcers, niko na goiter, niko na gastritis, na naona hata hizi dawa ndio imeleta ugonjwa zingine kama ulcers. Sasa bado niko kwa medication na mahali nimefika siwezi hata kujimanage sasa na hii shida yote hizi ugonjwa karibu sita.
Now, I think at least you have got a glimpse of what is happening, and I want us to talk about the hidden cost of healthcare system. Now, this is a story that revolves around a woman's story that everyone should hear. Earlier on in my earlier videos, I've shared about taking care of your health, meaning your own health is your own responsibilities that you need to take into account, and you need to treat with a lot of seriousness. Imagine being told that the medicine you desperately need exists, but getting it, it feels almost impossible. For millions of people around the world, healthcare isn't just about hospitals. It's about affordability, accessibility, and survival. Today, we are discussing a powerful story that has sparked conversations online about healthcare, medication, and the struggles ordinary families face or encounter when they reach a point whereby they are seeking medication or healthcare services. So let us dive in. Um, the video that I've shared earlier, follows a woman sharing her personal experience with illness and medical treatment. She explains how health complications affected her life and highlights the challenges she encountered while trying to receive proper care. As she speaks, images of large quantities of medicines remind viewers of the enormous role pharmaceutical play in modern healthcare system. Whether these medications represent treatment, shortage, or broader healthcare issues, one thing becomes clear is that healthcare is more than doctors and hospitals. It's about access. And you have to think about this way. Do you think that the medication that you are taking is offering you good health? I'm not saying medication is bad. This is a disclaimer. I'm not saying seeking medication is bad, but basically what I'm trying to say is the treatment that you're seeking, is it the actual treatment that offers you the healing, or there is something else? Have you thought of it that beyond the medicine you take, there are other alternatives? Because actually these medicines, the over-the-counter medicine, the only thing that they do to you is to maybe hide the problem. They hide the problem, the underlying issue. There are scenarios we have heard about misdiagnosis. We've seen that people have been given wrong medications. Later on, it is realized that that the medicine wasn't, the disease wasn't the one that was actually being treated. Think about that. Why stories like this matter? Many people only realize how important healthcare is when they or someone they love becomes seriously ill. Seeing a single diagnosis can affect family finances, employment, mental health, children education, the overall quality of life. Behind every prescription is a person hoping for another chance at life. And always remember, a patient healed is a customer lost. Remember, these pharmaceutical companies, they are in business. Assume it this way. What will happen if all the people in the hospitals, all those who are ill, were healed today? Okay, I know it is impossible, but think of it that way. It means all the pharmaceutical companies will go broke, will be rendered, the revenue will go down. So for them to be able to sell this medicine, what happens? Because the medicine is being produced every single day. You have to think, because if you are healed today, those medicine will not be of any good to you. That is why it is always important to take care of your health. Remember, you're the customer. Your illness makes you a customer to them. And you need to take your health very seriously. Okay, let's continue. The bigger picture in this particular story is whereby this story reflects on a much larger conversation happening across many countries. Questions people continue asking include: why are some medicines so expensive? Why do some hospitals experience shortages? Or how can healthcare become more accessible? You know, what role should governments play? You know, uh, then how can communities support vulnerable patients? These aren't easy questions, but they deserve thoughtful discussions. But before we reach at that particular point, we have to make a resolute decision to take care of our health before that one happens. There is a saying that says that it is better to take food as medicine rather than taking medicine as food. Look at that video very cleanly. You will realize that she has sacks of medicine that she has taken for the past 22 years. 22 years. And she's still taking, but her issue has not been solved. Meaning, she has been exchanging medicine. She goes to the hospital, she's given another one. She goes to this hospital, she's given another medicine. Day in, day out, different medicine. This is something that I also experienced in one point in my life, whereby my mother, may God rest her soul in peace, she was sick, and I was forced to buy chunks of medicine, a heap of medicine, which in the long run or at the end of the day never helped them. That is where I made a resolute decision that now rule number one is that my health always comes first. Depending on my lifestyle, the food I eat, how I behave, and so on and so forth. These medicines, they are in business. They are in business, and you are the customer. Understand this. Think about COVID. COVID-19 created billionaires. The other day, you witnessed Anthony Fauci being questioned about COVID and the programs they have been running, and you realize some of these things are being made up. These are stories that are being made up to make you sick. The kind of food, the kind of herbs, the kind of trees you would have taken has been demonized, such that it is made to feel like they're unuseful to your body. But I'm not saying that the hospital medicines are bad. Literally, what I'm trying to say is understand the underlying issue, because some of these medicine, they are meant just to cover up or just to prolong you. But at the end of the day, they are creating an underlying issue that won't be solved. At the end of the day, it will cost you dearly. It will cost you dearly. So we need to have this kind of conversations. Your health, these days we have entrusted our health to the doctors, not to ourselves. Maybe you have overworked your body, and after overworking, you need to rest. But instead of resting, maybe you feel some headache, you rush to the chemist to get some, or to the pharmacy to go get some drugs because of your headache. Okay, you forget that your body is very intelligent, that it needs rest. You know, that is why I'm saying that your health is your responsibility. It starts with you, not the doctor. The doctor is secondary. An issue that persists for long, that is why you are told that when an issue persists is when you seek medication. But you must understand one thing, that this medicine that you're being prescribed, others are just to calm or to reduce the pain, but not to solve the problem. That is why other doctors will tell you, we are just curing you, giving you medicine, but only God heals. Don't you think? Can't you think what they mean? It means Theirs is just to offer you treatment, not to heal you. Okay? These are just, that's why it is called prescriptions. They are prescribing with the hope that whatever you have been given will heal you. Think. Your health is your priority, not the priority of the government. But also, it means that we need to have systems, because also lack of this access to healthcare, access to good foods, nutrition, good nutrition, also is a problem. Because these days we eat foods that contain a lot of chemicals, beginning from tomatoes, onions, rice, maize, uh, and the foods that are sold. Those are not food, they are just products. At the end of the day, they begin interfering with the intelligence system of your body. I'm not a doctor. No, this is just researchers have done about health. That is why my health is always my priority. And in the process of seeking to understand every situation and everything, I have to be very cautious about it. There are lessons that we can learn from this kind of stories. They are sad. She's appealing for help to sort her medication. Think, appealing for help to solve her or to assist her acquire more medicine. And the child ended up with a problem. She has been ailing for 22 years. She's still alive. Yani, the medicine are just holding her life. Meaning, if she doesn't take this medicine, it means she might even go ahead, she can die. But the problem was caused 22 years ago. 22 years ago when she went for delivery, whereby she was injected with some medicine. She was induced, labor induced. Then, okay. So all these are things that we need to be attentive. We need to be alert always. And always one important lesson is that health should never be taken for granted. Never should you take your health for granted. Many of us say that there's a saying that says in Swahili, people like saying that mwili mpya tutapewa mbinguni, like we will be given new bodies when we go to heaven. So meaning we live recklessly here on earth. We take everything. But remember, there are those diseases that are lifestyle diseases. Sometimes we can avoid them. But because we are failing to understand that the responsibility of our health relies solely on us, it means we are not taking preventive healthcare systems. And we are not taking any prevention. Remember, prevention is better than cure. But we are not doing that. We are focusing on cure instead of prevention. Because preventive healthcare remains one of the best investments anyone can make. Simple habits like regular medical checkups. We have things like healthy nutrition. We have things like exercise. We have things like following medical advices from qualified professionals. Qualified professionals. Underline the word qualified professionals. And then we have also managing chronic illness early, can reduce future complications. But remember, sicknesses are one of the causes of poverty. You have taken many years acquiring wealth, like 10 years. But in less than 1 year, whatever you have acquired for a period of 10 years will be wiped away by a disease. Why use a lot of energy trying to make uh, trying to acquire wealth, yet in the long run we are wasting ourselves? At the end of the day, you forget taking care of about your health. I'm not saying you shouldn't look for health, but the secrets of remember, we say that your health is your wealth. Take into account, your health is your wealth. That is the first wealth, because if you are sick, the sickness will be the suffering will be taking a lot of resources from you. It will create mental problems, your family, stress, and so on and so forth. So what does that mean? Very basic things that you need to do is to understand the working of the simple habits of healthcare, which you need to take into account. At the same time, societies must continue working towards healthcare systems that are affordable, reliable, and accessible to everyone. The government needs to create systems that enables the healthcare system to run. They need to ensure that the facilities are equipped, medicines are available for those diseases that can be prevented, those scenarios that can be preventable and managed. But these days, if you rely on the government, you will find it very difficult, because now the health issue remains on you. So this, in conclusion, is that this woman's story is not just about medicine. It's about resilience. It's about hope. And it is a reminder that behind every healthcare statistics is a real human being with dreams, fears, and a family. The resources that she has used to acquire those medicine could have been used to something else. But now, because of a misdiagnosis or a problem that was caused by certain medicine into her system, has caused her all that. This is something that we need to always have this conversation. We shouldn't ignore this kind of conversation. We need to have them daily, from the society to the government system, policies that address the healthcare system. Therefore, as I wrap it up, it is my humble appeal that remember, your health is your wealth. And for you to be able to acquire the wealth you are seeking, you have to ensure that you're healthy. You need to be healthy. If this story made you think differently about healthcare, leave your thoughts in the comment section. Leave your thoughts in the comment section. Always remember, leave. Let's have a respectful discussion. Have you or someone you know ever struggled to access medical treatment? Very many times. To me, very many times. But at the end of the day, everything comes back to you. Comes back to you. So let us have this discussion. Let us talk. Let us share every moment that we have. Let us take care of our health seriously. Thank you very much. And don't forget to subscribe. Don't forget to like. Don't forget to share. By doing this, we are able to reach out to people outside there, and we are able also to learn. This is very about our health, and we are able to educate each other. Thank you very much, and have a blessed moment. Goodbye.